Hi, I am Dr. Rasya Dixit. I am a dermatologist in Bangalore, practicing from the last 20 years. Today, I am here to talk to you about two of the most sought after treatments, anti-aging treatments, botulinum toxin and fillers. So, the whole world wants to now look younger and younger. And why is this craze of youth there? Because we have now defeated so many vaccine preventable diseases. We are now under control of all the health issues like the infections. So now the attention and the longevity has gone up, and everybody's attention is want to look as young as possible. And very, very importantly, nobody want to undergo a surgery to look young. So what are the treatments that you can have to look younger, to look more beautiful, more aesthetic, without undergoing a surgery? These are the two most important treatments. One is botulinum toxin, one is fillers. And both these treatments, can be done with a dermatologist OPD. You don't have to get admitted. It takes a few minutes of your time. And nobody knows that you've had a procedure, but you look more fresher, more relaxed, more youthful and more younger. So we are talking about these treatments. You have heard these treatments by the name of Botox, or you could have heard the name of neuromuscular relaxant injections or neurotoxin injections. What are these injections? So, as we age, the most common features which are visible on our face are the lines or the wrinkles. And these are normally seen on the upper face as the frown lines, which is seen in between your eyebrows, as the crow's feet, which is seen around the eyes, and as the forehead expression lines, as the worry lines. Why are they becoming more and more common in our younger population? It is because we are spending more and more time on digital devices. So when we spend time on digital devices, because these devices are lit, they have lit screens, we tend to frown in order to stare at them. And when we do that, we start developing the lines around the eyes and around the forehead. These are the lines which make us look more angry, more upset, or give away our age. So, what are the things that we can do to prevent it? Let me talk about the prevention methods before I go for the treatment methods. Like I told you, the most common causative is a digital device. So, reduce your device time, reduce the brightness of the device when you are working with the device, and very, very importantly, pay attention to your lifestyle. Eating healthy, exercising regularly. There can be no replacement for that. So the best medicine is for youth is always to eat healthy and exercise. Using a sunscreen will prevent the wrinkles from becoming more deeply set in your face. Sleeping on time definitely will help. Doing some form of physical exercise will also help. Quitting smoking, quitting very high carbohydrate rich food will also help in keeping the skin looking more youthful. If you've already developed the lines, well, then you need to seek treatment. So the treatment is something which is called botulinum toxin. This is a medicine which is given as a micro injection into the area which you want to relax. For example, if you wanted to relax the forehead lines, you would inject very small amount of this medicine using a micro injection into this area. What is the good part of this? Once you do the treatment results last for a good 4 to 6 months. You don't have to repeat the treatment for 4 to 6 months. And you get a very relaxed, refreshed kind of appearance. And nobody can make out that you had a treatment. So what type of wrinkles does this botulinum toxin treat? Does it treat all the type of wrinkles? No. It treats those wrinkles which come on action, like our forehead wrinkles, between the brow wrinkles and the crow's feet wrinkles. It is not used usually to treat the lower face wrinkles because it can cause difficulty in smiling. So, once you do the treatment, the results usually are seen within 2 to 3 days, and like I told you, they last for 4 to 6 months. The treatment is delivered through micro needles, making it very, very comfortable. Hardly even you are going to feel it. It takes only about 15 to 20 minutes to do the treatment, and you are not going to feel any pain. There are no side effects if you are having the treatment with a fully trained dermatologist. This treatment should not be done by somebody who is not trained, by somebody who does not have experience in it, and definitely not by a non-dermatologist. So please choose your injector wisely. because this is a treatment which is going to last for 4 to 6 months. You don't want to have an abnormal appearance for 4 to 6 months. So we spoke all about botulinum toxin, which was on the treatment of the upper half of the face. So what about the wrinkles which are there on the lower half of the face? We have noticed that around the nasolabial area, around the lips, there can be a lot of sagging and lines. For this, we use something called filler. Filler is different from botulinum toxin. Botulinum toxin, I told you, work by stopping the muscle from wrinkling. But here, the filler is going to replace the volume loss which has happened because of the aging, because of the weight loss. Now we know that a lot of people are on Mounjaro, they are on Ozempic. These are the medicines to help with rapid weight loss. And when also we all age, there is a lot of weight loss on the face. And this usually happens in the under eye area when we are in our 20s and 30s, in our mid cheek area when we are in our 30s and 40s, in our lateral cheek area and the nasolabial area as we approach into our 40s and 50s, which make us look very tired, which make us look very angry or upset or sad. So the treatment of this using a medicine called filler, which is having something called hyaluronic acid, is going to rejuvenate the skin, bring the skin to looking the normal position and reposition the fat in that area so that the skin looks more youthful. You can restore the contour of the face. So if you see the difference between a youthful face and an older face, you will see that there is a lot of volume loss in main areas like the mid cheek, lateral cheek and the nasolabial. So fillers are most commonly used in this area, the mid cheek, the lateral cheek, nasolabial fold, chin as well as lips in people who want to enhance their specific facial features. Again, this treatment is done as an injectable treatment in the clinic, takes about half an hour to 1 hour time, and the results are seen immediately and last from anywhere between 8 months to 1.5 years depending on the product which is being used and the area which is being treated. The advantage of both the botulinum toxin and the filler is number 1, there is no surgical procedure involved. Number 2, it can be done in a very subtle and gentle way where you look refreshed and you look relaxed and you look younger, but nobody knows what treatment you had. It can just be a secret between your dermatologist and you. But these have to be done by doctors who are specifically trained in it. So do speak to your IADVL dermatologist who is going to be very well trained in botulinum toxin and fillers to get the best out of this. So who is the correct candidate to undergo botulinum toxin or filler? Is it that you are too young for this procedure or you are too old for this procedure or you are not a celebrity like, so therefore you don't need this procedure? Absolutely not. You have to remember that all of us want to look a particular way. Sometimes we are seeing young people who are in their early 20s or early 30s having very, very deep frown lines which are in the mid-brow area because of the occupation, like I pointed out. So what does this do? It make you look angry, make you look more unapproachable, especially when you are going to mid-level management or senior management. So treating this area is actually going to make you more, not only more looking good, but also more relaxed, more approachable. So there is no age restriction as far as botulinum toxin or fillers is concerned. We have treated people who are as young as 24-25 years of age with both botulinum toxin and fillers so that they can look their best. Today's day and age where we are using the day of Instagram, where every interaction is a visual interaction. Whenever somebody calls, it's on a WhatsApp video call or it's on a Zoom call. A lot of my patients came to me during COVID because during COVID was the first time they went on a Zoom call, and in the Zoom call they were busy looking at their faces. They were not looking at their colleagues' faces. They were looking at their faces like, oh my God, doctor, I have such bad lines around my mouth, or I have such bad frown lines, or I have such bad dark circles. Can you please do something to treat me? Which is what the revolution has changed. People are very now focused on how they are looking. And they are using so many things like a filter or something like that to look good on the screen. So imagine that you can do a treatment which will be like a filter which you can walk around with. You don't need a filter. on Zoom or on your Instagram, you can actually look that good. Why wouldn't you go for that procedure? So that is the power of the botulinum toxin and the filler treatment, which can change how you look and how you feel about yourself.